survey, which was conducted in 2012, was conducted by scientists led by the HSRC, Medical Council, and South Africa's statutory research agencies. The surveys collected data not only on the HIV status of individuals, but also on information on the socio-demographic and behavioral factors that greatly enhanced the analysis and interpretation of the observed trends in HIV prevalence. Over 38,000 people were interviewed and almost 29,000 agreed to be tested for HIV. The estimated overall prevalence of HIV increased from 10.6% in 2008 to 12.2% in 2012. According to the survey, the increased prevalence of HIV in 2012 is largely due to the combined effects of new infections and a successfully expanded antiretroviral treatment program. According to principal investigator Professor Olive Chisana, the high prevalence levels amongst females in the country and HIV prevalence in unmarried cohabiting people require a rethinking of conventional approaches to HIV prevention with strategies that address the underlying social cultural norms in affected communities. Some findings from the report: majority of the respondents aged 15 and older believed that they were at low risk of acquiring HIV infections. 1 in 10 people who believed they were at low risk of acquiring HIV infections were already infected but didn't know it. The overall knowledge of how HIV is transmitted and prevented also declined from 30.3% in 2008 compared to 26.8% in 2012. Attitudes of South Africans to persons living with HIV have improved since 2008. The HIV incidence rate among female aged 15 to 24 years was over 4 times higher than for males in the age group. Ages 15 to 49 had the lowest rate of condom use. This poses the questions: are we as South Africans winning the fight against HIV?
For more on the story, we're now joined by Professor Leickness Simbayi, who is the Executive Director in the HIV/AIDS Sexually Transmitted Infections and TB program from our Cape Town studios. Good evening, Professor, and welcome. And on the line we have Andrew Hosana from the Treatment and Action Campaign. Hello, Andrew, and thank you for joining us. Now,
how are you,
Professor
madam?
Simbayi,
I'm fine, and thanks to your listeners.
Now, Professor Simbayi, what prompted the survey and how did you go about it?
Thank you, Lulu. Essentially, we have been undertaking this survey periodically every 3 to 4 years since 2002. And the main reason is for us to gauge how we are doing as a country in terms of our national response.
Now, Prof, were there any surprises from previous surveys?
Yes, indeed there were. For example, the finding that there was this increase in HIV prevalence. That was something I think we didn't know about until we saw the results. But when you think about it, it does make sense in this, because a lot of people have been going on treatment, as a result of which they are living longer. But unfortunately, we are still experiencing some new infections.
Now, Andrew, I'd like to speak to you now. This is where you come in. What did you think of the latest statistics?
The Treatment Action Campaign has welcomed the survey and the results of the survey, but however, there are arguments in terms of some of the findings of the survey. One is within the condom usage, 2 is within the escalation of people living with HIV that showed that from 2012 to 2014, the infection rate has went up. If there is enough information, enough education, enough access to condoms, why did they have to say we are going up in terms of HIV infection. The other challenge that I'm having now with you is that I cannot hear the professor from HSRC because there are many questions that I want to ask the professor.
Now, Andrew, in which areas do you think South Africans still need to be educated?
I think we need to go to the KZN. We need to go to the Eastern Cape. That's where the challenge lies. The KZN is one of the areas that need information that is clear within their own language. I cannot go to the Eastern Cape and get there and educate those elder men with my English that I'm talking to now. I need to make them understand within their own literacy language that they would understand. The other thing is that we need to respect culture and beliefs of individuals. In KZN, they don't believe in condom usage. And if condom usage is not believed, people need to understand that we need to bring another methodology in terms of prevention that people need to understand. Generally, I'm generalizing now, condom usage is not used. My question would be to the professor from the HRC, are there condoms available? Because there was a report that was released from the Eastern Cape that says there is lack of access to condoms, even in Gauteng. So let us be realistic and conduct a study for all the 9 provinces that we are dealing with, so that when we talk about something that has to do with prevention, we have a solid proof that tells us that there are no access to condoms or there are no access to sex education in schools. My other challenge is access to condoms in schools.
Hello, Andrew, can you hear us? I think we seem to have lost Andrew there. That line was a bit unclear. Professor Simbayi, did you hear what some of the things that Andrew mentioned? The fact that the wear condom issues in terms of delivery in some areas. What can you say with regards to this?
Okay, let me begin by clarifying when the study was actually done. The survey was done in 2012. So basically the changes which we are talking about are between the last but one survey which was done in 2008 as compared to 2012. We will be doing another survey next year, just for your information. So with regard to the levels of condom use dropping, I think there could be a multiplicity of factors or many factors that might explain that. It's one thing to have condoms available, and it's another thing for people to use the condoms. I think we still need to go back and basically promote the idea that even today, in an era when we have treatment available, it is important that people do practice safer sex as one way of reducing the transmission of HIV.
Now,
so probably what's happening out there is people in 2012, according to our survey, were not using condoms as much as they were doing before. The reasons for that, we don't know exactly what the reasons are, but part of at least one hypothesis might be that perhaps we need to improve the packaging, perhaps of the government-provided condoms, which have been there for quite a while, just to make them more exciting, even the way they are packaged to start with. But more importantly, we need a campaign which really reminds people about the fact that we live in a country with a high HIV prevalence, and we shouldn't forget that one of the ways of reducing new infections is actually correct and consistent use of condoms.
Now, Professor Simbayi, just touching on that, the fact that you are maybe looking at making changes. Minister of Health, Dr. Motsoaledi, last week said that they are planning on replacing choice condoms with exciting flavoured and coloured condoms next month in education institutions. Do you think this will help?
Partly, yes, it will help, but as I indicated, there's more to it. You can have the condoms available, but you need actually to encourage people to use them. So there needs to be an aggressive campaign to encourage people to go back, particularly those who are using, and also young people who are beginning to have sex, to actually see the importance that they need to use these condoms. So you can have nice colored and flavored condoms, but for people to use them, they have to be motivated somehow. And that's part of the educational prevention campaigns that are required.
Now, Prof, before we lost Andrew on the line, he touched on the fact that the survey has found that KZN has the highest number of infections in the country. What is it that KZN is doing differently compared to other provinces in terms of creating awareness and education with regards to HIV/AIDS?
Thanks for that question, Lulu. Again, just to clarify, KZN has always had the highest levels of HIV infection in the country. This has been found even from the antenatal survey among pregnant women, which were started early about 2000. In the 4 surveys that we have done, we have similarly found in each survey that province has had the highest number of people living with HIV and AIDS. Partly it's not surprising, it has to do with the large population size. But in terms of response, the province should be commended. In fact, their work on prevention is cited by the South African National AIDS Council as exemplary, as something that other provinces could learn from. Among others, there are several campaigns, some of which have started, but one success, for example, is that the number of people, or men in particular, who are undergoing medical male circumcision is very high in that particular province. And the reason is perhaps to do with the fact they are a non-traditionally circumcising community. And after the king and the premier at the time, 2-3 years ago, in 2010 actually, recommended that Zulu men should undergo male circumcision, there has been a positive response to that.
Now, Professor
But the treatment program too is largest in that province. And therefore, there have been significant gains, for example, in saving people's lives to start with. The number of orphans has stabilized. The number of children who are getting infected by their mothers has also dropped significantly.
Now, Professor Simbayi, we have to end it there. Thank you so much for joining us. Unfortunately, we have run out of time.